This is our YouTube clip on hepatitis B by Aoife Roach, Emma Muldowney and Aoife McHenry. So what kind of pathogen is hepatitis B? Well, hepatitis B is a virus. It's also abbreviated to HBV. It belongs to the Heptaviridae family and is a notifiable infection in Ireland. Hepatitis B can be classified into acute and chronic infections. Our immune system is capable of clearing an acute infection in less than 6 months, and the patient may recover within a few months, whereas chronic infection lasts more than 6 months and it lingers in our immune system as our immune system is unable to fight the infection. This may also last a lifetime. So what kind of infections does hepatitis B cause? Well, 5 to 10% of chronic HBV individuals are at risk of developing liver cancer, which may lead to death if left untreated. 30% of chronic HBV infected individuals may develop cirrhosis, which is a permanent scarring of the liver. To my left, I see a normal, healthy liver, and to the right you see a liver which is infected by cirrhosis. So who does this affect? This affects healthcare workers, people with multiple sex partners, people who inject drugs, people with chronic liver disease or kidney disease, or those travelling to countries with high incidence of hepatitis B. It can also affect me or you if you're not vaccinated. Hepatitis B also can affect pregnant women. Pregnant women are at risk of passing the infection onto their newborn. Therefore, routine neonatal testing was introduced to screen for hepatitis B.
What are the symptoms of this infection? Only some people infected with hepatitis B present with symptoms. These symptoms usually develop 2 or 3 months after being exposed to the hepatitis B virus. Many people infected in adulthood won't experience any symptoms and will fight off the infection without realizing they had it. However, they'll still be able to pass on the virus to others while they're infected. The main symptoms of hepatitis B is tiredness, a high temperature of 38 degrees Celsius or above, nausea, loss of appetite, diarrhea, yellowing of the skin and eyes or jaundice, and dark urine. How is this infection transmitted and what is the site of infection? The hepatitis B virus can survive outside the body for at least 7 days. During this time, the virus can still cause infection if it enters the body of a person who is not protected by the vaccine. The incubation period of hepatitis B virus is 75 days on average. Hepatitis B is most commonly spread from mother to child at birth. Hepatitis B is also spread by exposure to the infected blood and various body fluids, as well as through saliva and also sexual transmission. It's also transmitted through the reuse of needles and syringes. What is the incidence of this infection in Ireland? It is estimated that there are at least 350 million chronically infected cases of the hepatitis B virus worldwide. The prevalence of the HBV in Ireland is low. The prevalence of the surface antigen of the hepatitis virus in first-time blood donors tested between 1997 to 2010 was 0.1%. The HBV is more prevalent in certain subgroups of the Irish population, for example, prisoners, drug users, homeless people, and asylum seekers. There was a dramatic increase in notifications between 1997 and 2008, from 31 to 910 cases, mostly attributed to immigration to Ireland from HBV endemic countries. From 2004 to 2012, less than 10% of cases were acute, most of whom were born in Ireland and acquired the infection sexually, with most notified cases being chronically infected.
How is hepatitis B diagnosed? Blood tests based on serological testing are used in the lab to diagnose and monitor hepatitis B. These blood tests can also distinguish between acute and chronic Hep B. Diagnosis relies on the detection of the hepatitis B antigen HBs. Acute is determined by the presence of the HBs antigen and its corresponding antibody. The sample will also be seropositive for the HBe antigen, and the presence of this antigen indicates high replication levels of the virus and shows that the individual is highly infectious. Chronic hepatitis B is characterized by the persistent presence of the Hep B antigen HBs for more than 6 months. Consequences of this can include the development of chronic liver disease and liver cancer. How can it be treated? According to the World Health Organization, no medicinal treatment is administered for acute hepatitis B, just to replace fluids lost through vomiting and keep hydrated until symptoms diminish. Chronic hepatitis B is treated with oral antiviral drugs. These antivirals slow the process of liver cirrhosis and reduce the incidence of liver cancers. This treatment is unable to cure the patient, but it does slow replication of the virus down. Treatment of chronic Hep B is for life. Are there preventative measures available? A vaccine is available to help prevent the spread of the hepatitis B virus. According to the HSE, it is part of the 6-in-1 vaccine that is given at 2, 4, and 6 months of age. The vaccine is given over the course of 3 doses, one at 0 months, one month after the first dose, and the final is administered 6 months after the initial dosage. A blood test will then be taken at least 2 months after the final dose to check titer levels. If these levels are not adequate, a booster vaccine will be required. As part of our medical science program, we had to undergo the vaccination process for hepatitis B in first year, as in the lab we are in close contact with blood when carrying out diagnostic procedures.